When we are suffering from an illness such as arthritis, migraines, or even allergies, it is only natural that we reach out to a pharmacy or a doctor right away. Other times, like here in the Philippines, some use home treatments where people would substitute things like ginger, honey, and garlic for prescription medication. But did you know that there is also an alternative medicine practiced in some parts of the world which uses highly diluted substances? Practitioners claim that these can cause the body to heal itself. In this episode, let's learn more about the alternative medicine called homeopathy. I'm Dr. Freddy Gomez and welcome to MedTalk Health Talk on CNN Philippines. Our guests are here today to give insights on homeopathy. With us is Dr. Homer Lim. He is an integrative oncologist and president of the Philippine Society of Orthomolecular Medicine and International Anti-Aging and Integrative Medicine Society. And also with us is Ms. Denise Saldran. She is a homeopathic therapist and instructor and the head of Homeopathy Philippines. Now, thank you both for joining us on the program today. Now, Denise, as a homeopathic therapist, can you please share with us what homeopathy exactly is?
Okay, so homeopathy, as you mentioned, are dilute substances. So for example, we have a tincture. Let's say I have a bottle of calendula tincture. It's calendula flowers in alcohol. What they do to make a homeopathic version out of this is they take a 10% with 99% water, and then they bang it 100 times. And then they take 10% of that, put it in another bottle, another 90% water, bang it 100 times. So it goes through a process of dilution, and in between each dilution, it's succussed or some kinetic energy is added to it. So at the end of the line, all of this energy applied to it breaks down the electron bonds in the original tincture, and then that releases what we call the vibration of the remedy. So it goes more into quantum and nanophysics.
Now, in the Philippines, to practice homeopathy, one needs to secure a certificate from the National Certification Committee for Homeopathy under the Philippine Institute of Traditional and Alternative Care. Now, Ms. Denise, how prevalent is the practice of homeopathy here in the Philippines today?
So homeopathy in a classical sense is not really being practiced here in the Philippines. So what we call homeotoxicologists, they're not actually practicing the classical way of homeopathy. So actual classical homeopaths, I'd probably say probably none. What we do is we just teach the lay people how to practice homeopathy at home because they're very safe substances. They don't have any toxicity whatsoever. So that has been my advocacy, is just how to bring homeopathy to the layman and into the home and how to practice it safely.
Dr. Homer, how does homeopathy help people side by side with conventional medical treatments?
Well, actually, when we try to integrate conventional medicine with homeopathic medicine, it will be a bit challenging, especially for those who are practicing homeopathy, because some of the effects of the conventional medicine might actually mask the effect of homeopathy. But in general, no, in like what they are doing in Germany, in Austria, in Switzerland, they're actually combining conventional medicine with homeopathic medicine. So I think that has to be emphasized, that you can really use homeopathic remedies with conventional medicine. The reason behind this is we want to achieve a better result with regards to treating a certain disease or ailment or a condition with the least amount of side effects or the least amount of drugs to be given, because at the end of the day, it's really about how to make the patients have a better quality of life, at the same time less likely to develop adverse events or side effects.
Okay, so better quality of life definitely is a good target for this. Now let's discuss a little bit about the management process, the treatment process of homeopathy, to further understand how these remedies, these treatments are achieved. Now, Denise, can you walk us through how you diagnose and prepare the treatment for your patients?
So what we usually do is we go through a question and answer interview as well, some medical history, and then from there we get what are the major complaints. So we don't go by the name of, let's say, eczema or bronchitis. We go by the symptoms. Just like going to a regular doctor, you give your symptoms and then you try to choose the appropriate remedy. Because I failed to mention in homeopathy, how we choose a remedy is we match the symptoms of the what we call the poisoning symptoms of a remedy with the symptoms in a sick person. And when I say poisoning symptoms, I'm just saying, for example, onion. When you cut an onion, you start to tear and then you start to sneeze. Those are the poison symptoms of onion. So we match it to somebody with a common cold or rhinitis with a similar manifestation. So that's how we match the symptoms.
Now, Denise, why is knowing the general health, emotional state, lifestyle, as well as diet important in how treating your clients will be?
Because we are a vitality therapy. We're not a medical modality. It's more of increasing the vitality of the organs. Like, for example, somebody has a liver issue. We increase the vitality of the liver by giving the homeopathic remedies to invigorate the liver. So, of course, diet is very important because you don't want to bring down the vitality of the liver. Another thing is also we look at the whole qi, like traditional Chinese medicine. Emotions affect, trauma affects, all of these external and internal emotional actions affect the vitality of the bodies.
Now, is this kind of treatment safe for infants, Dr. Homer?
Oh, yes, definitely. For homeopathic medicine, I think this is one of the better alternatives. I'm sure a lot of mothers there who are very concerned with their babies and children with regards to giving drugs or antibiotics or, some of the Western medicine, they're a bit concerned. So a lot of mothers are actually now looking into homeopathic remedies because they are really safe, generally safe, and very infrequent side effects.
That's a good point, Dr. Homer. You mentioned that they're generally safe. Let's talk about some of the side effects. How common are side effects here? Maybe allergic reactions when it comes to homeopathic treatments?
You rarely have allergic reaction to homeopathic remedies unless they have allergic reaction to certain what we call excipients, because homeopathic remedies can be in several forms. It can be in liquid drops. It can be in pellets. So these pellets, sometimes they're coated with certain ingredients that, might develop allergy. But homeopathic remedies, because they are diluted to an extent wherein it's very minute, the allergic reaction is actually almost, zero.
When we return, we'll go over some of the more common ailments that homeopathy can treat, as well as the risks to be aware of before beginning some of these treatments. Only here on MedTalk Health Talk. I'm Dr. Freddy Gomez and welcome back to MedTalk Health Talk, where caring is our calling. Now, before the break, we learned what homeopathy basically is and how these remedies are created specifically to enhance the vitality of a person. Now, for some Filipinos, depending on which region you are from, they have some beliefs that certain herbs and plants can be used to help treat ailments like a sore throat or the common cold. Now, Denise, of the common ailments that Filipinos undergo, they suffer, which ailments do you see most which have a great effect with homeopathic remedies?
Actually, the homeopathy has its greatest effect in emergencies and accidents. So we have remedies, let's say, for arnica, for blunt head trauma, or they fall. We have calendula for wounds. We have lachesis for snake bites. We have apis for insect bites. So it's in an emergency situation where you see it really acting fast, and it will really buy you time before you reach the hospital, or if you have no access whatsoever, at least you're already giving something. So for me, that's the first class that I teach, is always emergency prescribing, because you could really save a life. Like, for example, even in collapse, difficulty breathing, we have carbo-veg. So in any emergency situation, there's always something that can revive you. And this really helps if you're getting yourself to a hospital. For that short period of time, it can be a lifesaver.
Now, which illnesses, Denise, are challenging to treat using homeopathic remedies?
For me, because we consider this alternative care, I get a lot of the end game. They've tried everything. They've tried steroids, they've tried antibiotics, they have Steven Johnson's, or they have eczema that already has too much steroids. So those are the most challenging because then we have to detox all of that. We have to detox the layers of medication that have sort of cloud the picture, and maybe that can take 6 months to a year and even more. So just like in the regular medical field, it's those with very serious chronic ailments that have a lot of suppressions.
Now, Dr. Homer, what factors should people consider before they think of undergoing a homeopathic treatment plan?
Well, if the most important thing to consider here is really the getting a experienced homeopathic practitioner, because there are literally thousands of homeopathic remedies out there, and choosing the best homeopathic remedy really requires a lot of experience and knowledge with regards to these homeopathic treatments.
If someone has an adverse reaction to some of the treatments, although you mentioned that it would be rare, are they prepared to treat these reactions?
What's nice about homeopathic remedies is all you have to do is actually just stop. So immediately when you stop it, if there are any allergic reactions or adverse reactions, it usually would disappear within 3 to 4 hours, because the effect is really, for some of these remedies, are short term. So the adverse reaction or the length of adverse events or side effects is really not that significant.
What are the limitations of homeopathic medicine, if there are any? We'll discuss this after the break. Keep it here on MedTalk Health Talk. Welcome back to MedTalk Health Talk. Now that we've discussed some of the ailments that are addressed by homeopathic medicine, the risk factors that you have to consider before going down this path, let's now find out the limitations, if there are any, of practicing homeopathic medicine. Now, I'll start first with Denise. Up to how serious of an illness can homeopathic medicine be able to address?
In my experience, it works hand in hand with regular medicine. So it can be as serious as possible. Like, for example, my father had stage 5 kidney disease. We're able to extend his life by many years with the use of homeopathic remedies as well as his regular remedies. So because it's a vitality therapy, it increases the vitality of the body. It really doesn't have that much limitations as long as you know what remedies to use. And of course, how to use it hand in hand with whatever therapies you're undergoing as well.
Now, Dr. Homer, what are some of the considerations, someone who's never tried homeopathic medicine, what are some of the considerations before undergoing alternative medicine choices, especially those with chronic diseases?
Well, I think the most important thing to consider really is, are there any side effects or adverse effects if you do use homeopathic remedies? So these side effects are very rare and seldom. So if you really want to try homeopathic remedies, would suggest you seek a consult with a experienced and knowledgeable homeopathic practitioner. So I think there's really not much of a problem, unless of course you take several homeopathic remedies altogether. So you should not try to self-medicate.
Okay, that's a very good point. That's why I'd like to ask Denise how risky it is for someone to practice homeopathic medicine on their own without consultation with someone who is very familiar with the ingredients that you may use.
Actually, as a first aid and acute, it's quite safe. That's why they sell it in Whole Foods, in the grocery. Because it's a couple of sugar pills that you can take if you have a cold. The worst thing that can happen is it's not going to work, but there's not going to be any adverse effect. So if you feel like you're taking something for your cold and your cold is getting worse, then it's probably because you just chose the wrong homeopathic remedies. I would be more careful, of course, when we're going into chronic illnesses or people that are very delicate, old age, or very asthmatic young children. That's where they really have to be careful. But for run-of-the-mill emergencies and acute situations, it always helps.
Denise, what would you advise someone who has never tried homeopathic medicine yet? How should they go about it? Someone who's a beginner amongst this form of treatment.
Well, I would get probably a few first aid remedies such as arnica for bumps and bruises, calendula. So maybe about 8 to 12 first aid and then to start trying it from there. And then, once you see how fast it makes your wound heal or how clear your bruise becomes after a day or so, then you'll become more inspired to try other remedies for other more involved ailments.
Now, Dr. Homer, what is the homeopathic landscape currently now here in the Philippines?
So actually, you might be surprised, homeopathic remedies, especially here in Manila, it's there's a following. Similarly, in Visayas and Mindanao, there's a group of doctors. It's called the Philippine Society for Integrative Medicine and Homeopathy, or homotoxicology. So they use a bit of homeopathic remedies from Germany. We also have, aside from Ma'am Seldran, we have Jake Tan, Dr. Jake Tan, who's a homeopath also. He's quite famous. So it's been around for, I would say, at least 20, 30 years now.
Now, Dr. Homer, that's one important thing, especially for someone na baguhan pa lang with homeopathic medicine and they want to seek the correct information with someone who is qualified. What can someone who is new to this watch out for to decrease the risk of getting wrong information?
Well, we have, again, the Philippine Society for the Integrative Medicine on Homotoxicology. It is now a certified provider for training on homeopathy and homotoxicology. You just have to look for those doctors who are part of this organization who have been certified by PITA. If you have those certifications, I think you're more likely to be safe and you'll get the proper or right homeopathic remedy for your condition.
Unfortunately, that's all the time we have. But before we go, I'd like to hear from Denise. If you have any words for our audience, any tips, any advice?
Well, for my only advice is don't be afraid to try it because it can only really increase your vitality. So it's very safe not to worry about it.
And of course, Dr. Homer, any parting advice for our audience?
For everyone who's listening, if you're taking a big number of conventional drugs and you feel that it's not helping, you might want to look into homeopathic remedies because they do have a certain efficacy and safety, I think, which is very, very important, safety and efficacy.
Thank you so much, Dr. Homer Lim and Ms. Denise Seldran, for being with us today, sharing some information and your insights on homeopathy. I'm Dr. Freddy Gomez, and thank you for watching Med Talk Health Talk. We'll see you again next time.